Hi, my name is Dr. Natalie Lawrence, and if you're watching the video today, it's because you or someone that you care about is suffering from a thyroid disorder. I've been a chiropractor since 1997, and I've been in private practice here in Tequila, Georgia since 2002. I have extensive postgraduate studies in nutrition and things like blood chemistry and endocrinology, thyroid disorders, brain and neurotransmitters, and a variety of neurology classes as well. So in our office, when we look at thyroid disorders, we look at, well, first of all, let's talk about what it means to have a thyroid disorder. Most people are going to be suffering, the vast majority of you are going to be suffering with hypothyroid type symptoms. Hypothyroid type symptoms can be most often extreme fatigue and an inability to lose weight even with a good diet and exercise. Those two symptoms right there are probably the biggest ones that are going to drive women to go to the doctor to be checked for something like hypothyroid. Additionally, women suffer with constipation. They have problems eating fatty foods because of gallbladder issues. We can see blood sugar regulation problems with that. Cold hands and feet is very big. Hair falling out in clumps is also a common symptom. Eyebrows that are thinning on the outer third. Depression and brain fog also would go with that as well. Additionally, a lot of you are going to suffer also with some hyper-type symptoms, and those can be heart palpitations, probably the most common. Additionally, anxiety, not able to sleep at night, inward trembling. So those are some of the hyper signs. Normally what we see in our office is really a little bit of both. Most people have a little, meaning that most patients present with symptoms from both categories. And normally when we see that, the differential diagnosis is at least going to have in it Hashimoto's thyroiditis, which is the autoimmune thyroid problem. Now, by the time you get here, you've probably been to another doctor's office that has run some type of panels on you. But I have to tell you, from a medical standpoint, which is sometimes driven by the insurance companies, the panels that you get run are really not big enough. They don't encompass enough testing to give us all of the information that we need to make a viable diagnosis, and then a treatment plan that would most match that. Additionally, the lab ranges that are used are so broad that your disease process has to be fairly progressed in order for it to show up on the labs. So, speaking of the lab testing that's done, the incomplete lab testing that's done, I should say, most often what we see is that a TSH has been run and a T4 has been run, and I got to tell you that that isn't just not enough to figure out what's going on. It's the system is way more complex than two markers can fetter through. In our office, we run minimally a TSH, total T4, total T3, T3 uptake, and we always run the antibodies. Why? Because the vast majority, definitely over 50%, or probably closer to 90%, of people who suffer with hypothyroid or who've been diagnosed with hypothyroid are also Hashimoto's, or have the autoimmune disorder called Hashimoto's, which is an immune system problem and not so much a thyroid problem. So in order for us to ascertain that, we have to run a complete thyroid panel, which normally isn't done. Secondly, even when the panel is run, the TSH lab values that are being used are too broad. Let me say this, with lab values, you have 100 people that go to the lab. They get the same test done. And at the end of the year, the lab takes all those 100 people, their results, and they put them all together. They hack off the first 10, they hack off the top 10, and then everything in the middle is the normal range. Well, anyone knows that the vast majority of people that are going to get blood work done are sick people. They're people that have cancer, they're taking chemo treatments, they have any other number of illnesses or disorders, and to use that average of sick people as your goal of what's okay is a bad idea. So what we do is we look at you from a functional range. The functional range is going to be a lot narrower, and because of that, we're going to catch things before the system is totally out of whack and before it's so progressed that maybe there's some permanent things that are going on that can't be changed. For instance, on the TSH in lab values is probably 0.45 to 4 or 5.0. The functional ranges that we use are 1.8 to 3. Where do we get those? We get those from the Endocrinologist Society. And those ranges are based on where does that have to fall for your body to be physiologically at its peak, doing everything that it's supposed to be doing and functioning at 100%, which is where you want to be, right? You don't want to be with the people who are all sick, okay? So the two problems that we have, or the two problems that we see with people who've had testing done is, number one, it's incomplete because they only run a couple markers and you can't get what's going on when you do that. And that maybe they've had the test run, and maybe the test, if I looked at it, would show that it was functionally wrong, but the lab isn't going to say that it's wrong. So the doctor in turn says that you don't have a problem. Okay, that's what we see with the lab testing. There are also inactive and active hormones that the thyroid makes. And I'm going to get into a little bit of the physiology just because you need to have enough knowledge of how the thyroid works to understand how it dysfunctions. Suffice it to say, we're not going to make an endocrinologist out of you in 5 minutes. But the basic thyroid physiology is this. The hypothalamus tells the pituitary to tell the thyroid to make some thyroid hormone. Okay? The thyroid makes two hormones. It makes T4 and T3. T4 is the inactive, basically inactive hormone, and T3 is the active part of thyroid hormone, the one that actually activates the cells. So the vast majority of thyroid hormone that's made is T4, 93%. Only 7% of the thyroid hormone that's made in the thyroid is T3, or the active form. So in order for your body to actually utilize the thyroid hormone, it has to be converted. So that conversion process happens in 3 different areas of the body. Number one, it happens in the liver. About 60%, the vast majority gets converted in the liver. 20% gets converted in the gut, 20% gets converted in the periphery, or the peripheral tissue out in the body. So let me ask you this. If you have a liver issue, whether it's cirrhosis, maybe you've had hepatitis, maybe you take a variety of different medicines that negatively impact your liver, and you have high liver enzymes, maybe you have a gallbladder that's backed up, okay? Any number of those things can create a problem in the liver where it's not going to be functioning like it's supposed to, and it will jeopardize the conversion of T4 to T3, okay, which means that you're not going to have enough of the active hormone to activate the cells, okay? That's number one, liver. Number two is going to be the gut. The gut has to be right as far as the flora there, as far as the health of the gut has to be good in order for that 20% of conversion of T4 to T3 to happen there. Any number of things can create a problem there. Number one, you can have food sensitivities that create inflammation, which disrupt the gut. You can have bacterial, parasitic, yeast infections in the gut as well. And all of those situations will negatively impact the gut function also. We can also look at the periphery. Okay, and what most normally happens, and there are lots of things that can happen, but the thing that's most common, especially here in the United States, is that there's too much cortisol. And we get that because cortisol is a stress hormone. And we get that because most of us are stressed out. We live here in the United States, we're way overbooked, we're way too busy, we don't get enough rest, and we suffer, okay? And the cortisol is too high. And that's the third place, that if the cortisol is too high, you're not going to get proper T4 to T3 conversion. So the only way we know if that's happening is if we run a full lab panel of thyroid. You are not going to see that running a TSH and a T4, okay? Some of the other tests that we do, and what makes us different here is we run a variety of metabolic and neurologic tests, okay? We leave no stone unturned. We're going to look at you from two viewpoints. We're going to look at your physiology, your blood chemistry, and the way that your body works on one side, which is the metabolic side. But we're also going to look at you neurologically. And what that means is, how's the brain working? Okay, the brain and the nervous system. And how is that contributing to the problem that you have? So from a metabolic standpoint, we're going to run a variety of tests, okay? We run complete thyroid panel, like I just discussed. We run a lipid panel, which includes cholesterol, triglycerides, HDL, LDL. We're going to look at just basically the way the kidneys, the liver, all of those functions are going to be looked at under a microscope through your blood work. We're also going to be looking at inflammatory markers. And those are important for a number of reasons, because inflammation, again, will decrease the conversion factor of T4 to T3 as well, and it just makes you feel bad. To do those, we look at homocysteine, which is the most indicative marker for cardiovascular disease, although I never see it run on any lab panel. CRP, and we also look at fibrinogen. Fibrinogen has to do with clotting. So all three of those really, when they're high, contribute to increasing your risk for cardiovascular disease, which is something you'd want to be aware of. Additionally, we run an adrenal panel. Why? Well, for a couple reasons. The adrenals are little glands that sit up on top of your kidneys. They're our stress glands. If you're someone who suffers with insomnia, which is very common, or blood sugar regulation problem, which is really right across the board, pretty much everybody, we're going to be looking at your adrenals. The adrenal glands are responsible for making things like cortisol, and they're also responsible for making hormones, okay? So extremely important that we look at the adrenal glands. We also look at food sensitivities. If you have a problem with any type of food that you're eating on a regular basis, it's making your problem worse. Mainly we look at gluten. For thyroid patients, gluten is a problem for everybody. Okay, I haven't seen anyone that hasn't been a problem with yet through testing. Casein, which is dairy, soy, eggs, and yeast. We look at all 5 of those, determine whether or not you have a problem with them, and if you do, then we need to eliminate them from your diet and eliminate the problem that they're causing you. The next test that is extremely important is a gut pathology test. And what that does is it looks at DNA PCR testing for gut pathogens. And what I mean by that is for bacteria, for yeast, for parasites, which are extremely common, way more common than you may think they are, okay? Even here in the United States. And the overall health of the gut flora in general. And that is an invaluable test. I'm telling you, we run that on everybody because it's so important to fix that if it's a problem. Additionally, we run an intestinal permeability, and that lets us know if the gut is leaky, because if the gut's leaky, then you will react to everything that goes in your body, you're going to form a reaction to. And it creates a lot of inflammation and a lot of havoc, and it doesn't allow you to absorb the nutrition from the food that you're eating, and that's not good. Hormone panels, we run on everybody, especially women, okay? Because when the endocrine system or the thyroid isn't working appropriately, then it's going to really affect everything else in the endocrine system. And female hormones are part of that as well. When you have a hormone disruption or a disorder, you are going to have anything from like heavy, horrible periods to PMS to mood swings. If you're menopausal, you will have hot flashes, you will be growing facial hair, and a whole host of other things that are just unpleasant and unnecessary. There are also specific dietary and metabolic things that we do in the office. And again, it's all dependent on when we run the tests, we look at what's going on with you personally, and we design those nutritional and metabolic interventions based on what it is that you need personally. Okay? So if there are foods that you need to eliminate, we're going to eliminate them from your diet. We're going to make sure that you're eating when you're supposed to, what you're supposed to, and how you're supposed to. We're going to make other changes in your lifestyle. Some of you may be going to the gym and working out 3 hours a day, which is really counterproductive to getting you taken care of. We're going to make sure that you're sleeping enough and things of that nature. So that's really the metabolic side of things, because really the metabolic side, in my experience, is really the driver for the neurologic side, although they both are important. And I say that because on the neurologic side of things is the brain and the nervous system. The brain needs 2 things to be successful in its job every day, and that is it needs enough fuel and it needs activation. The fuel that the brain uses is glucose, or blood sugar, and oxygen. So if you don't have enough of either, then the brain doesn't have the fuel that it needs to do its work. So from a metabolic perspective, if you have a blood sugar regulation problem, and what I mean by that is you have diabetes, you have hypoglycemia, you're not going to have good blood sugar going to the brain, and the brain's not going to have the fuel that it needs on a regular basis to function. Additionally, if you have something like an anemia, which is really common, your brain's not going to get the oxygen that it needs. So with our new patients, we run a full neurologic exam on them as well. And that allows us to find out what things aren't working appropriately in the brain so that we can use the appropriate intervention to stimulate them. Because the brain needs the fuel and activation. The fuel are the glucose and the oxygen that we talked about. The activation are things that are stimulation from the environment. So when we can locate and really focus in on exactly where the problem is in the brain, then we can utilize the most appropriate protocols to stimulate that area. And how do we do that? Well, we do it in lots of different ways. We can use things as simple as like vibration, shining a light in your eyes, doing eye exercises, listening to certain types of music in a certain side of the, in one ear or the other. We can use calorics. We can use a device called auriculotherapy, which is like acupuncture but without the needles. We use non-surgical spinal decompression. We use TENS. We use heat. So really there's plenty of things that we can do. And again, the thing I want you to remember here and really get is that the treatment is totally indicated by the testing. And that's the way we get you better. We leave no stone unturned. We look at everything. We look at you metabolically with all the testing we just described. We look at you neurologically with all the testing we described. And once we get all the information that we need and we know where the problems are, then we can fix them most appropriately. And that's why we're successful. So if what I've said to you here today strikes a nerve with you, great. I'm glad. I'm glad we could pass along some information for you. I want you to think of this. The type of problem that you have when you have a thyroid disorder, because I have a thyroid disorder as well, it doesn't get better if you don't take care of it properly. It continues to get worse, and you continue to get worse. And I'm sure for those of you who've had a thyroid disorder for any length of time, if you look back to when you first got diagnosed or started not feeling well and you look to where you are now, that you can probably look at that as being a steady progression downward or downhill. So I want you to think about, if you don't do anything other than what you've been doing, which is not really working for you, where are you going to be at in 1 to 3 years? How's that going to negatively impact your family, your ability to work, your relationships with other people? Okay? What I would like to encourage you to do is to go to the place on the page that has the form to fill out. Once you fill that form out, we're going to get that information here at the office, and we will get a packet in the mail for you that will include a free report. And then we'll also send you a video that will be longer than the one that you've looked at today. It'll give you a lot more information, a lot more detail. So go ahead and do that now. You also find a spot on the page that outlines when our next workshops are. If you will click on that, it'll let you know when the next workshop is in the office, because really the best thing I can offer you is to come in and really do a live workshop in office. They're all different a little bit, and it's just a lot of great information. So again, I encourage you, fill out the form, let us get you some paperwork out in the mail, or better yet, call up and schedule for our next upcoming thyroid workshop. You're going to learn a lot, and it definitely will not be a waste of your time. You will enjoy it. You're going to get some good information there. So again, Dr. Natalie Lawrence, thank you for taking the time to listen to what I have to talk about today, and I look forward to seeing you in the office soon. Thanks.